Cuando el añerito la puse sentado y yo pensaba, no sé
si... The joint plane of the cervicals is at a 45-degree angle. We're going to show you the dog spine, which is almost identical except it's bigger. That's the best that we could do, bringing your spine over. But these joints, starting at C2 to C3, are at this angle. So if I was going to adjust this, my elbow has got to be toward the ceiling, and I've got to get this horse to want to laterally flex. So I'm motioning. There's another segment at C3. I'm just going to put a force in. We already got the lower one on the right, and we're going to do this one. Is the horse happy? Yes. You can tell, right? So you can imagine walking around with a tiny little rock in your shoe under your heel. Just the amount of intensity, right? Well, you got a massive bone where the bone is locking on bone. That's cartilaginous, but bony stimulus. And then you've got nerve that's irritated. It's intense. So when a horse, once you can make an adjustment and a correction in it, the horse immediately knows it. And these guys will tell you, some of the, I mean, they come around, they'll kiss you. I mean, they're like, you'll be up there and they'll come right around, put their muzzle right on your face, because you can imagine how long that's been there. And they know immediately. So motioning, we have to ask. This is a very hard concept to grasp, but you must ask the animal, is it okay? Now, are you asking? No. But in your heart, you're asking, can I have your permission to work with you? And I'm going to ask, and I'm going to laterally flex. And I'm asking, is he willing? Sure, he knows what I'm up to now. So I'm going to ask, lateral flexion, lateral flexion, lateral flexion. Pretty good. Really good on this side. The other side is as good as this is. That's how bad the other side was. So really, really good. And I have to get underneath him to motion the atlas and axis. And we're going to just get underneath. This is called what on a horse? It's called the pole. And this is really where you assess the atlas and axis. For those of you on this side, I'm going to put my fingers between the mandible and the lateral mass, and I'm going to put 3 fingers here, and you got to kind of guesstimate on the other side because you can't see it. Make sure the horse is in the midline. Put your fingers in here, put your fingers in here, and pretty much 3 and 3, which is good. Lots of times you're going to put, it's going to be 1 finger, 4 fingers, 2 fingers, 4 fingers, and you're going to see that the atlas will do, the atlas is going to ride superior, inferior, superior, inferior, posterior, anterior. So you get superiorities and posteriority. And the way we assess that is just getting underneath here, and I'm going to start to motion. Now, this left side is really subluxated on the left. And so this would be a left posterior atlas. And it's going to look different than what's actually happening. That this joint, we're going to have to show you on the spine. We're just going to ask this horse to bring the head down, and I'm going to put a force in to move that. And it moves very easy. And this side is very good, and they know immediately. So when we were talking last night, for those of you who were at the top, when you adjust the horse, it's not like you have to wait, right? It's immediate. So we've got the atlas. This was a left posterior atlas, and in actuality it's a left inferior atlas, and I pulled that up. There's a little posteriority, but inferiority this way. You can get on them from this side and do them. We'll show you that later today. I like getting underneath of them to do it. You're not going to do this today, but it's very important to be able to check the TMJ of a horse. And we're going to slide our fingers in under the gum. You're not going to do this, but we're going to, this lower jaw should move this way. Can you see that? Now all I'm doing is putting my finger up on the gum. You got to be very careful. These teeth are very bad, and he's got a lot of edges here. And I want to do it the other way, and the jaw should go this way. Now in a horse that's got a big subluxation, the TMJ will load here. This will get really tender. The masseter will contract, and they won't have good motion. That's bad in terms of, not only because it maintains the subluxation, but it's bad in terms of colic. You want them to be able to obviously polarize everything. So in order to correct these, we're taking this and this, and we're rocking that lower jaw, and you should hear the teeth rattle. When we go to correct these, we're grabbing the mandible, and it's a very strong pull straight down the mandible. And that's where we're going to stop with this horse. We could probably use them to do lateral flexion. We're going to work from lateral flexion all the way through the thoracics. And we're ready for two more. And we're going to work